As we cross the age of 50, our bodies naturally undergo changes. Spinal discs lose hydration, muscles lose strength, and joints become less flexible. Bone density may decrease, and posture often worsens due to years of sitting, bending, and physical stress. Back pain at this stage is not a sign of weakness. It is a sign that the body needs targeted care. The good news is that movement, not medication alone, is the most powerful long-term solution. As we move beyond the age of 50, the human body naturally undergoes structural and physiological changes that directly affect the spine. One of the most significant changes occurs in the intervertebral discs. These discs act as cushions between the vertebrae, but with age, they gradually lose water content and elasticity. This loss of hydration reduces their ability to absorb shock effectively, leading to stiffness and discomfort, particularly in the lower back. Over time, even simple daily activities such as bending, lifting, or standing for extended periods may begin to cause pain. Muscle mass also declines with age, a process known as sarcopenia. When the core and back muscles weaken, they provide less support to the spine. This increases the mechanical load placed directly on the spinal joints and ligaments. As a result, minor strains that would have healed quickly in younger years may linger longer and feel more intense after. Joint degeneration is another contributing factor. The cartilage that protects the facet joints in the spine can gradually wear down, leading to inflammation and reduced mobility. In some individuals, this may contribute to conditions such as spinal stenosis or osteoarthritis, both of which are more common in older adults. Postural changes also play a critical role. Years of sitting, working at desks, driving, or using digital devices often lead to rounded shoulders and forward head posture. These imbalances place continuous stress on the lower back. Reduced physical activity further compounds the issue. Stiffness increases when the body is not regularly moved. Back pain after 50 is rarely caused by a single problem. It is usually the combined effect of aging tissues, weakened muscles, reduced flexibility, and accumulated lifestyle habits. The first and most foundational movement I recommend for individuals over 50 or experiencing back discomfort is the gentle pelvic tilt. This exercise may appear simple, but from a clinical perspective, it is highly effective because it directly targets the deep stabilizing muscles of the abdomen and lower spine. These muscles, particularly the transverse abdominis, act like a natural corset that supports the lumbar region. As we age, these stabilizers tend to weaken due to inactivity, prolonged sitting, and reduced core engagement. To perform this movement safely, lie on your back on a firm but comfortable surface with your knees bent and feet flat on the floor, hip-width apart. Allow your arms to rest comfortably at your sides. Begin by taking a slow, controlled breath in as you exhale. Gently tighten your abdominal muscles and press your lower back into the floor by slightly tilting your pelvis upward. The motion is subtle. There is no need to lift the hips off the ground. Hold this position for 5 seconds while breathing normally, then slowly relax and return to the starting position. From a medical standpoint, this movement improves spinal alignment and reduces excessive arching in the lower back, which is a common source of pain in older adults. It also enhances blood circulation to the lumbar muscles, promoting healing and reducing stiffness. Practicing this exercise daily for 10 to 15 repetitions can gradually strengthen the core, improve posture, and decrease strain on the spinal joints. Over time, patients often report reduced morning stiffness and greater comfort during daily activities such as walking, standing, and climbing stairs. The second exercise I strongly recommend for individuals over the age of 50 is the cat-cow stretch, a gentle yet highly therapeutic movement designed to restore spinal mobility and flexibility. As the body ages, the spine often becomes stiff due to reduced joint lubrication, muscle tightness, and decreased daily movement. Many older adults wake up feeling rigid in the morning or experience discomfort after sitting for extended periods. This stiffness limits range of motion and increases strain on surrounding muscles and ligaments. To perform the cat-cow stretch safely, begin on your hands and knees in a tabletop position. With your wrists aligned under your shoulders and your knees under your hips, Keep your spine neutral and your neck relaxed. As you slowly inhale, allow your abdomen to lower toward the floor. Gently arch your back and lift your head and tailbone upward. This position encourages spinal extension and opens the chest. Then, as you exhale, round your spine toward the ceiling, tuck your chin toward your chest, and gently draw your abdomen inward. This flexion movement stretches the back muscles and relieves tension along the spine. From a clinical perspective, this rhythmic motion improves circulation to the spinal discs and surrounding tissues, enhancing nutrient delivery and joint lubrication. The coordinated breathing pattern also activates the parasympathetic nervous system, promoting relaxation and reducing stress-related muscle tightness. Performing this stretch slowly for 8 to 10 repetitions allows the spine to move through a safe and controlled range of motion. Over time, individuals often notice improved posture, reduced stiffness, and greater ease when bending, turning, or performing routine daily activities. The third exercise I consistently recommend for adults over 50 experiencing lower back discomfort is the glute bridge. Many individuals are surprised to learn that persistent back pain is often not solely a spinal issue, but a consequence of weak hip and gluteal muscles. When these muscles are underactive, the lower back compensates, absorbing forces it was not designed to manage alone. Over time, this compensation creates strain, inflammation, and chronic discomfort in the lumbar region. To perform the glute bridge correctly, lie on your back with your knees bent and feet flat on the floor, positioned hip-width apart. Your arms should rest comfortably at your sides. Begin by engaging your abdominal muscles gently to stabilize the spine. Then press through your heels and slowly lift your hips toward the ceiling until your body forms a straight line, from your shoulders to your knees. Avoid arching the lower back excessively. The movement should come primarily from the hips. Hold the position for 5 to 8 seconds while breathing steadily, then lower your hips back down in a controlled manner. From a clinical standpoint, this exercise strengthens the gluteus maximus, hamstrings, and deep stabilizing muscles that support the pelvis. Stronger hips reduce mechanical stress placed on the lumbar spine during walking, climbing stairs, and standing for prolonged periods. Additionally, glute bridges improve pelvic alignment and enhance balance, which becomes increasingly important in preventing falls as we age. Performing 10 to 12 repetitions daily can gradually restore muscular support around the lower back, leading to reduced pain and improved functional mobility in everyday life. The fourth exercise I recommend for individuals over the age of 50 who are experiencing lower back discomfort is the knee to chest stretch. As the body ages, the muscles surrounding the lumbar spine often become tight due to prolonged sitting, reduced physical activity, and natural degenerative changes in connective tissue. This tightness increases compression in the lower back, contributing to stiffness, aching, and limited mobility. Gentle stretching plays a critical role in relieving this built-up tension and restoring comfort. To perform this stretch safely, lie on your back on a comfortable, supportive surface. Keep your legs extended initially and your arms relaxed at your sides. Slowly bend one knee and bring it toward your chest, using both hands to gently hold the shin just below the knee. Pull the knee toward your chest until you feel a mild, comfortable stretch in the lower back and hip region. The movement should be controlled and pain-free. Hold this position for 15 to 20 seconds while breathing slowly and deeply, allowing the muscles to relax. Then release the leg gradually and repeat on the opposite side. For a deeper stretch, both knees may be brought toward the chest simultaneously, provided it feels comfortable. From a medical perspective, this movement gently decompresses the lumbar spine and stretches the paraspinal muscles, gluteal muscles, and hip extensors. It promotes improved blood circulation to the lower back, which aids in tissue recovery and reduces muscle guarding. Practicing this stretch regularly, particularly in the morning or before bedtime, can reduce stiffness, improve flexibility, and provide noticeable relief from chronic lower back tension, commonly experienced after 50. One of the most important principles I emphasize to adults over the age of 50 is that when it comes to relieving back pain, Consistency is far more powerful than intensity. Many individuals believe that stronger, faster, or more strenuous exercise will deliver quicker results. However, the aging spine responds best to gentle, controlled, and repeated movements performed regularly. The goal is not to exhaust the body, but to retrain and support it gradually as we age. Tissues recover more slowly than they did in our younger years. Muscles, ligaments, and joints require time and steady stimulation to adapt. Sudden high-intensity activity can aggravate inflammation or cause strain, especially in a spine that may already be dealing with disc thinning, joint degeneration, or muscle weakness. On the other hand, small daily efforts build strength safely and stay named. Performing these exercises for just 10 to 15 minutes a day can significantly improve circulation, enhance muscle activation, and maintain joint mobility. Repetition strengthens neural pathways between the brain and muscles, improving coordination and stability. Over weeks and months, this steady approach reduces stiffness, supports better posture, and decreases the frequency and severity of pain episodes. It is also important to listen carefully to the body. Mild muscle engagement is expected, but sharp or radiating pain is not. Adjustments can always be made to ensure safety and comfort. The true secret to healthy aging is not pushing beyond limits, but respecting them while remaining active. When movement becomes a daily habit rather than an occasional effort, the spine regains resilience, and long-term relief becomes achievable. As we come to the end of this discussion, it is important to remember one essential truth. Back pain after 50 is common, but it is not something you are destined to live with forever. The body changes with age, yes, but it also adapts, strengthens, and heals when given the right support. We have talked about why back pain increases after 50. Disc dehydration, muscle weakness, joint stiffness, and postural imbalance all play a role. These are natural processes, not personal failures. Understanding this removes fear and replaces it with control. When you understand the cause, you can apply the correct solution. The 4 exercises discussed, pelvic tilts, cat-cow stretch, glute bridges, and the knee-to-chest stretch are not complicated. They do not require expensive equipment or extreme effort. What they require is intention and regular practice. Each movement targets a specific need: core stability, spinal mobility, hip strength, and muscular flexibility. Together, they create a balanced support system for the spine. The most powerful takeaway is this: gentle daily movement can transform spinal health. 10 to 15 minutes a day can improve circulation, restore flexibility, strengthen supportive muscles, and reduce mechanical strain on the lower back. Over time, this consistency reduces pain, improves posture, enhances balance, and supports independence. Healthy aging is not about avoiding activity, it is about choosing the right activity. The spine was designed to move. When movement stops, stiffness increases. When movement returns, function improves. Your body has carried you through decades of life. With small, consistent effort, you can reduce discomfort, regain confidence in your movement, and protect your independence for years to come. The choice to begin can be made today.